Well again, welcome to our DAN education series of the heart, health and diving, and this is the last chapter, chapter 7. There's a lot of detail in this chapter because we are going to be discussing the various cardiovascular drugs and the drugs that may be associated with all the conditions that we have been discussing over the past 6 chapters. So hold on to your seats and we hope that you find it interesting. Keep watching. In this section, we're going to be talking about a number of cardiovascular drugs, which include anticoagulants, antiplatelet drugs, statins, antihypertensives, and antiarrhythmics. Now, what are the issues with cardiovascular drugs? Well, the issue is that divers who take drugs to treat cardiovascular diseases often worry about the medication compatibility with diving, but in most cases, it's the underlying condition, not the drug, that is the main concern. True, some drugs may have side effects that preclude diving. Divers should be very familiar with the side effects of any medication that they take and should discuss this with a diving physician or a relevant specialist. And be sure that the physician that you consult knows about your planned diving activities. A one-time clearance to dive does not mean that you have indefinite clearance, because conditions may change and there may be a progression of an illness or disease, so that there are changes in your health status that would prompt yet another examination before you go diving again. So let's start with the antiplatelet and anticoagulant drugs. There are essentially 2 classes, and they're sometimes collectively known as blood thinners. Their goal is to reduce the risk of clot formation and thereby deep venous thrombosis, pulmonary embolism, heart attack, and stroke. They may also be prescribed for individuals who have been diagnosed with atrial fibrillation, or those for whom heart surgery and heart valve surgery has been planned or has taken place, and they now have a stent, an implanted pacemaker, an artificial heart valve, and a number of other possibilities. And this has been discussed under the various conditions that we mentioned in the previous 6 chapters. Now, clots form when blood cells, known as platelets, stick together, and the proteins in blood bind them together until they become a solid mass. Clotting is a normal function that limits and stops bleeding when a blood vessel is injured, but if a clot grows out of control, whether it starts with travel or any other means, and then when it grows out of control and essentially migrates or increases in size towards the larger blood vessels in the leg, it may ultimately pose a threat not only to the circulation to the lower extremity that is usually involved, but very importantly, clots may get lodged in the pulmonary artery as they break off and cause pulmonary embolism. And we've discussed that in detail as well. If these blood vessels are blocked, whether they're in the lung or in the heart or in any other organ such as the brain, they will cause oxygen starvation. And we call that different conditions like heart attack or stroke. And all of these events can be potentially life-threatening. So antiplatelets and anticoagulant drugs prevent the blood from clotting as quickly or as effectively as it typically would. And that sounds like a good thing, but in certain conditions, that may actually predispose divers to more significant bleeding if they were injured and, for instance, if they were to develop decompression illness. Now, certain drugs such as aspirin and clopidogrel, also known as Plavix, work by preventing platelets from sticking to one another, whereas other anticoagulants such as heparin and warfarin prevent the clotting proteins and thereby slow down the chemical reactions that lead to the formation of a clot. There are also several new anticoagulants that have been approved between 2010 and 2012, including rivaroxaban or Xarelto, dabigatran or Pradaxa, and apixaban or Equus. The major effect of all these antiplatelet and anticoagulant drugs is the potential for excessive bleeding. So those taking such drugs, especially at high dosages, may bleed or bruise easily and may experience bleeding that does not stop as quickly as usual. We'd like to make special note of warfarin or Coumadin. Individuals who take warfarin or Coumadin are generally advised to avoid activities in which they may experience abrasions, bruising or cuts, such as contact sports or adventure sports. They're also urged to exercise caution when even brushing their teeth and shaving, because trivial injuries, even insect bites, may cause complications in an individual taking warfarin. And of course, the various opportunities that exist in cutting, bumping, or having some sort of injury, including equalizing problems with the ear, which may result in significant bleeding in the middle or even the inner ear. In addition, both travel and the various dietary issues that may interfere with the action of warfarin make it a somewhat unpredictable drug. The healthcare capabilities in popular but remote dive destinations may not be able to provide the necessary care in the case of an adverse event. So one needs to weigh all of those factors and keep them in mind when making the risk-benefit decision about diving on Coumadin. Many people that are on Coumadin or warfarin are able to dive without major complications, but it is not a one-size-fits-all. There are key safety conditions that need to be stuck to. There needs to be regular testing and surveillance by a physician. With good control of blood thinning, the risk of bleeding complication is fortunately quite low. According to well-known diving cardiologist Fred Bouvet, for divers, the most important question is whether the condition which requires the use of Coumadin or Plavix prohibits diving. In many cases, the illness is over or chronic but well adjusted and does not interfere with safe recreational diving. Safe diving with Coumadin or Plavix depends on the absence of illness which would limit diving. Careful control of clotting time, avoiding ear or sinus squeeze, and thorough education on drugs and foods that may cause changes in the effects of Coumadin. There are many divers using Coumadin and Plavix who are diving safely, but they must take and make special effort to understand and to avoid the problems of excess or not enough anticoagulation. The next class of drugs that we'll mention are the statins. Now, this is a detailed section, and we're going to refer to a table that you can see some of the drugs listed, but they all more or less do the same thing, and that is to lower so-called bad cholesterol or low-density lipoprotein cholesterol. It's called bad cholesterol, which is probably not a good term, but it is called that because it can lead to inflammation and plaques in blood vessels, particularly the coronary and the neck arteries that can result in a heart attack or a stroke, particularly if the plaque ruptures and there's bleeding. How statins work is by inhibiting a liver enzyme that produces cholesterol. They're effective with certain types of elevated cholesterol, but not with all. The list here shows the various different statins and other cholesterol-lowering drugs. They do have some things in common that need to be understood. Almost 90% of subjects report some side effects on statins and some of the other cholesterol-lowering drugs, including dyspnea or discomfort, cognitive dysfunction, and muscle pain. Tendon complications may also be significant, and there may be digestive problems and rushing or flashing, which may result in discomfort or a sense of heat. Fatigue was reported in almost half of those that were studied in 2012. There may be changes in blood sugar, and there may be an increase in fatigue in individuals taking statins. So it's important to realize that feelings such as soreness, tiredness, or weakness in the muscles may not necessarily be as a result of the dive or the activities involved with diving. They may be a side effect of the medication. Scientists aren't sure of the cause of the pain, but it might be because there's blockage of a molecule of the body that generates energy, the so-called CoQ10. And clinical trials are now exploring the possibility of taking CoQ10 supplements to prevent this complication. There are a few concerns with excessive supplementation, but again, the recommendation is to get proper advice from your cardiologist and dietitian and diving physician. Rarely, statins can lead to life-threatening muscle damage or even breakdown of muscles, but that's rare. There are other drugs that may interfere with statins, such as antibiotics and certain antidepressants, and even grapefruits may interfere with certain statins. So there's a lot to keep in mind and a lot to ask questions about. Certain drugs should not be taken in combination, and again, these are possibilities that should be thoroughly explored before these drugs are used in the context of diving. Don't just start the medication without the supervision of a doctor, and be prepared to notify them if there are side effects that influence your quality of life or interfere with diving. Well, though some effects of statins certainly could interfere with diving, there are many individuals who dive with it nonetheless. Statins may interfere with the blood vessel response to diving and exercise, and it may also influence the inflammatory response, which in certain cases is a normal part of healing. We don't understand all the potential complications related to statins, but it is something that should be considered and discussed, as we've mentioned. Especially if you're over the age of 45, it is necessary to not only look at the cholesterol and the statins, but also have a thorough cardiovascular assessment so that one can determine whether there's narrowing of the coronary and the neck blood vessels, which is of course the target organs or the target areas that we are primarily concerned about. If there's any doubt about the fitness to dive, discuss it with your dive operator, call Dan, or call your cardiologist or diving practitioner. Don't just dive in without proper information. And lastly, that brings us to antihypertensives. Now, hypertension is a common condition to the extent that it's even called essential hypertension, which means almost inevitable hypertension. Now that's not entirely true, and diet and exercise may lower blood pressure significantly, and conservative measures should be tried in most cases. But if indicated, antihypertensives may be appropriate. We'll start off with one of the classes that we're most concerned about, and those are the beta blockers. Now, beta blockers have the potential drawback that they influence a diver's ability to exercise, or at least potentially so. The more modern beta blockers have less of an effect, but it is necessary to determine that an individual is able to exercise to the full capacity that is necessary and appropriate for diving if they are taking beta blockers. So again, it is something that we'd rather avoid, but if exercise can be maintained, it may be appropriate. Again, the underlying condition may be a more significant consideration than the drug. Another class is known as the ACE inhibitors, or angiotensin converting enzyme inhibitors, or their related drug called angiotensin receptor blockers. These are typically the drugs of choice. In other words, the drugs or medications that we would recommend to start divers on. One of the concerns with ACE inhibitors, as opposed to the angiotensin receptor blockers, is that they may cause coughing, a chronic cough even, that may be confused with asthma or other pulmonary conditions. And coughing underwater is certainly not something that you'd want to do. Other options for blood pressure are calcium channel blockers, and they typically don't cause too much of a problem, but one of the concerns is that they may drop blood pressure very rapidly if a person takes on the standing position after being on their haunches or sitting or lying or getting out of the water, and this may be cause for concern if it causes fainting or dizziness. Diuretics, and those used to be the first-line drugs, but nowadays diuretics are not the preferred medications anymore because there are loss of trace elements and there may be excessive dehydration, particularly in a diving environment. Then, lastly, antiarrhythmics. Antiarrhythmics may be prescribed primarily as a result of rhythm disturbances, but they may sometimes also be added as a treatment of hypertension or other cardiovascular conditions. Please bear in mind that all of these medications do have potential impact on diving, and get good advice and make sure that you're fit to dive, and don't start diving immediately after changing medication or starting medication. There are resources that we are referring you to, and we encourage you to look at that if you are taking any of these medications. With that, we'd like to close off a very comprehensive look at health, the heart, and diving. We hope that you have found it useful, and we hope that you would encourage others to look at this material and educate themselves about the importance of the cardiovascular system and diving. We hope that you will join Dan if you're not a member already, and if you are, we'd like to thank you because it is your contributions that have made these presentations and the others possible. So, until we undertake the next series, safe diving, and thanks for watching.